धन्वंतरी स्तवन करे।
नमामि धन्वन्तर्योऽदिदेवम् सुरासुरैर्वन्दितपादपङ्कजम् लोके जराभयमृत्युनाशनम् दातारमीशौ विविधौषधीनाम् शङ्खं चक्रं जलौकां दधदममृतघटं चारुदोभिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यां शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसत् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढ दावाग्निलीलम् वन्दे धन्वन्तरिं वन्दे धन्वन्तरिं वन्दे धन्वन्तरिं
मनपूर्वक धन्यवाद सर। जैसा कि मैंने अभी कहा था कि आज हमारे साथ एक मल्टीफैसेटेड व्यक्ति है, उनका परिचय करवाना मैं अपना सौभाग्य समझता हूँ। आयुर्वेद, मॉडर्न मेडिसिन, संस्कृत साहित्य और संगीत जैसे कई क्षेत्रों में लीला संचलन करने वाले आदरणीय वाक सर आज हमें रक्तक्षयी आमवात इस विषय पर अपना मार्गदर्शन करने वाले हैं। ये ऐसे प्रैक्टिशनर है जो महाराष्ट्र मेडिकल काउंसिल और महाराष्ट्र काउंसिल ऑफ इंडियन मेडिसिन दोनों संस्थाओं के रजिस्टर्ड मेडिकल प्रैक्टिशनर है। आदरणीय वाक सर ने अपना MBBS और MD इन मेडिसिन पूरा किया है और उन्होंने मास्टर ऑफ साइंस इन रूमेटोलॉजी यूनाइटेड किंगडम से प्राप्त किया है। उस समय की आयुर्वेदाचार्य की डिग्री BA MNS पुणे से तथा मास्टर ऑफ आयुर्वेद साइंस चिकित्सा विषय में उन्होंने पुणे से प्राप्त किया तथा वे उन्होंने आजकल रोग निदान में आयुर्वेद DY पाटिल यूनिवर्सिटी से PhD भी कर रहे हैं। तो वैद्य क्षेत्र को छोड़कर उन्होंने तिलक मराठी विद्यापीठ से संस्कृत लिटरेचर में अपनी MA संस्कृत की उपाधि गोल्ड मेडल के साथ प्राप्त की है और भारतीय विद्यापीठ से MA संगीत तथा अखिल भारतीय गंधर्व महाविद्यालय से संगीत अलंकार की पदवी भी प्राप्त की है। रोमेटोलॉजी के क्षेत्र में उन्होंने भारत के प्रख्यात शिक्षण संस्थाएं जैसे कि GS मेडिकल कॉलेज, KEM हॉस्पिटल, AKN सिन्हा इंस्टीट्यूट दिल्ली और विदेशों में भी स्विट्जरलैंड, सिंगापुर, जर्मनी, इटली से कई नामांकित संस्थाओं से रोमेटोलॉजी का अपना ज्ञान प्राप्त किया है। API टेक्स्ट बुक ऑफ मेडिसिन और मैनुअल ऑफ रोमेटोलॉजी में इनके चैप्टर्स समाविष्ट है। आदरणीय वाक सर रोमेटोलॉजी इन प्राइमरी केयर के संपादक है और इस ग्रंथ की लगभग 17,000 कॉपियां बिक चुकी है। इससे इसकी लोकप्रियता का हम अंदाजा कर सकते हैं। वाक सर रोमेटोलॉजी ट्रेनिंग प्रोग्राम फॉर फैमिली डॉक्टर्स का भी आयोजन करते हैं। सामान्य लोगों में रोमेटोलॉजी का शास्त्रोक्त जानकारी का प्रचार हो, इसलिए उन्होंने लोकल लैंग्वेजेस में भी कई किताबें लिखी है, जिसमें संधिवात, व्यायाम और योगासने, संधिवात औषधे आणि आहार विहार, इनकी मराठी, हिंदी और अंग्रेजी संस्करण भी उपलब्ध है। संधिवाताचे दुखणे यह आर्थराइटिस और रोमेटोलॉजी की पब्लिक अवेयरनेस के लिए डेडिकेटेड भारतीय भाषा में पहली किताब है। संधिवात माझे अनुभव, ये उन्होंने अपने प्रैक्टिस के एक्सपीरियंस पर एक किताब लिखी है। वाक सर के कई प्रबंध प्रख्यात जर्नल्स में प्रकाशित हो चुके हैं, जिसमें मॉडर्न मेडिसिन के जर्नल्स और आयुर्वेद के रिलेटेड जर्नल्स भी समाविष्ट है। IME, एसोसिएशन ऑफ फिजिशियंस ऑफ इंडिया, इंडियन रेमेटोलॉजी एसोसिएशन, अखिल भारतीय आयुर्वेद महासम्मेलन, इंडियन एसोसिएशन फॉर स्टडी ऑफ ट्रेडिशनल एशियन मेडिसिन जैसी संस्थाओं के वाक्सर लाइफ मेंबर है। वाक्सर का परिचय इतने अल्प समय में करवाना मुमकिन नहीं है, इसलिए मैं उनका क्षमा प्रार्थी हूँ। मैं डोगरे सर से विनती करूंगा कि वे वाक्सर का बायोडाटा ग्रुप पर शेयर करें, जिससे उनके व्यक्तित्व का भली भांति परिचय हमें हो सकेगा। मैं वाक्सर से विनती करता हूँ कि वे अपना व्याख्यान शुरू करें।
Okay. Thank you, Sandeep. And I must express my thanks to Dr. Vinayji Dongre for giving me this opportunity to to express my views about Raktakshay and Amuvat. This lecture will be in English. Actually, I used to read and study and teach Ayurveda until 2005, and then I lost contact for so many reasons, and now I have restarted relearning in Ayurveda. So, if there are any mistakes or if there are any shortcomings in this lecture, please excuse me for them. We can rectify. I am always here to learn. We can always rectify, and we all must go ahead in this particular yajna of learning Ayurveda. So this is my first slide. Go to the first slide. We have some lakshanas of Ama and Samavayu and Amavata, Samanya Lakshana. These are 18 lakshanas there. This Aruchi, Apakti, Nishtiva, Hridaya Gaurav, Agnisad, Antrak Pujan, Anil Mudata, Malasanga Vibandha. These are all Annavasrotas Lakshana. Then we have other lakshanas like Jvara and Trishna, Srotorod, then Gaurava Angamarda, Alasya, Balabramcha, Darbalya, Klama and Tandra. Then Vedana Nistod, Angashunata Shot, and finally, as Madhukosh Tika has mentioned, there is the vriddhi of these symptoms due to steya and others, as well as Surya Meghodaya Nishi. Suryodaya, Meghodaya, and Nishi, the features of Ama are aggravated. Then in Madhavanidan, there are Prakupita Amavat Lakshana. Out of these, total 20 Lakshanas are there. Out of these 9 Lakshanas are the same as this Ama and Samvayu Lakshanas. Other Lakshanas are again Annavasrotas Lakshanas, Vairasya, Kupchikatinta, Kukshishul, Ana, and Chardi. Then other Lakshanas include Jadya, Nidra Viparya, Brahma, Murcha, Bhaumutrata, and Da. And the involvement of joints is here Yugapat Kupitav Antatrikasandi Prabhichako Stabdam cha Kurtoy Gataram Amavatasya Uchyate Sakashta Sarva Roganam Yada Prakupito Bhavit Hasta Hasta Pada Shiro Gulfa Trika Janu Uru Sandishu Karoti Sarujam Chotam. Now this Sarujam Chotam, that means pain plus swelling, which means inflammatory arthritis. Yatra dosha प्रपद्यते सदेशो रुज्यते व्याविद्यव वृश्चिकै. So these are the features of Prakupita Amvad. Now this painful swollen joint is also described in what we call Sandhigatavad, which is amongst one of the Ashiti Vatavika, and it is also given in the Firanga Sandhishu Abhyantara Sasyat Amvata Iva Vyatam. And in Vatarakta, although they say that there is an inflammatory joint involvement. See, Janu Jangur Kati Aunsa Hasta Padanga Sandishu Kandus Purana Nistod Veda Gaurava Suptata. So there is no mention of swelling in this particular shloka of Vagbhat. Now there are in contemporary rheumatology, we have various types of inflammatory arthritis. The first and foremost is, of course, rheumatoid arthritis. That is the most common cause of inflammatory arthritis. Then we have spondylitis, like ankylosing spondylitis, psoriatic arthritis, arthritis associated with inflammatory bowel disease, reactive arthritis. Then juvenile idiopathic arthritis, inflammatory connective tissue diseases like systemic lupus, vasculitis, systemic sclerosis, then polymyositis, MCTD, mixed connective tissue disease, and polymyalgia rheumatica. Then crystal diseases like gout and CPPD associated arthritis. Infectious arthritis, that is bacterial and viral, that includes leprosy, tuberculosis also, and others, that is sarcoid arthritis. So these are various diseases that are described under inflammatory arthritis, all of which we can call them as Amvata. But I take rheumatoid arthritis as a prototype of Amvata. Now, rheumatoid arthritis was earlier diagnosed on the basis of morning stiffness, arthritis of 3 or more joints, symmetric arthritis, arthritis of the hand joints, rheumatoid nodules, the presence of rheumatoid factor in the blood, and some X-ray pictures like erosions and osteopenia. These were the seven criteria laid down in 1987. Now, later on, these are the 2010 ACR ULR classification criteria, in which they say they have given 50% weightage to the number of joints involved. If there is a single joint, there is no weightage for diagnosis of rheumatoid arthritis. And if there are more than 10 joints, amongst which at least one is a small joint, the weightage is 50%, that is 5. Then rheumatoid factor and anti-CCP antibodies, these should be positive. The weightage is 0, 2, and 3. And symptom duration of less than 6 weeks, there is no weightage. More than 6 weeks, there is weightage. And acute phase reactants, there is CRP and ESR, which is given weightage. So here, the number of joints involved is important. Among the blood tests, the rheumatoid factor and anti-CCP antibodies is important. Then the disease duration is important, 6 weeks, less or more. And these two blood tests, ESR and CRP, are important. Now you can see that they have omitted The symmetric arthritis, then rheumatoid nodules and X-ray pictures have been omitted. Okay, that is about inflammatory arthritis. Now about anemia. Anemia is a state of low hemoglobin associated with impaired oxygen delivery. I'm sure you are knowing everything about this. In males, it's less than 13 grams. Females less than 12 grams is known as anemia. And there are various types of anemia, like iron deficiency anemia, then megaloblastic anemia, hemolytic anemia. And there is one important thing which we are going to discuss here is anemia of chronic disease, which is of different types. We shall be discussing more about anemia of inflammation. There are various features of anemia given in this picture. The you might recollect the various features starting from Karnak Shwed in various features given in the disease of Pandu. Now there are central features, then we have features of the blood vessels, features related to heart. You can recollect the Ratsakcha Lakshanas, then splenic enlargement. Spleen is the Moolastan of Raktava Srotas. Intestinal changes, muscular weakness, Raktam mounts is the third dhatu. Respiratory shortness of breath, then skin. You can recollect Bekavarna, Hatendriya, eyes yellowing, etc. So anemia in RA or Raktaksha in Amwa is 30 to 70% patients of RA have anemia of chronic disease. That is ACD. Actually, that term has now gone probably. It is known as anemia of inflammation. It appears early in the course of the disease. It is usually mild to moderate, and it correlates with raised ESR and disease activity. This is important. So disease activity is how active is the disease. I usually give an example that active disease is like a burning house, and it should be controlled as early as possible. Otherwise, it will certainly lead to damage of various things, various items in that house. Similarly, active RA, active rheumatoid arthritis, is something like a burning house, and it will as long as it is burning, it will certainly cause a very serious damage to the internal organs, especially joints, as well as the other organs. Starting from eyes to lungs to kidneys to blood vessels and so on. Ineffective erythropoiesis is the basis of anemia in rheumatoid arthritis, which returns to normal on remission of rheumatoid arthritis. This is also important. It returns to normal on remission of rheumatoid arthritis. That means it is dependent upon the activity of rheumatoid arthritis or any other rheumatic disease. Nutritional anemia and gastrointestinal blood loss can be associated. The nutritional anemia is extremely common in India. It is 52% of Indian women are anemic, 35% mild, and 15% moderate. This was the National Family Health Survey carried out in 2015. It is likely that this percentage has gone down, but it is there. It still persists, especially in the middle and lower socioeconomic classes. Now, anemia is important in Amwat because uh, anemia causes impaired quality of life, negative impact on the symptoms of rheumatoid arthritis, because uh, 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 especially because we can have pain as a rheumatic symptom, and we can have pain and fatigue and other symptoms due to anemia also. Then anemic patients have a significantly faster uh, X-ray damage. This is important. Very severe anemia means extremely severe joint damage. Anemia is that's a predictor of a worst outcome, and higher hemoglobin levels are associated with better disease outcomes, namely the disease activity index, then the CRP, then the VAS scale, uh, then pain on a VAS scale, then patient's global assessment, and tender joint count. Uh, these are all specific terms. I can explain them in some other meeting, or if you want, you can ask the question later on. And higher hemoglobin levels also lead to better patient reported outcomes, because patient reported um, outcome is also important. रुजा कर्तृत्वात् रोग एव, or namely patient global assessment, VAS on the pain, HACT, health assessment, the quality of life, and FACIT, that is the index for fatigue. The all references are given below. You can read them later on. Rakta you know everything about Rakta by now, because so many lectures have already been organized. Saklu apyo raza yakrut priyano prapya ragam upeti. So yakrut and pliya are important. Deyatse rudram moolam rudrene madare. So dharan and jivan are the functions of Rakta Dhatu. Shonitavahanam Srutasam Yakrut Moolam Pliyacha. So this is also, well known. Raktavay Dve Tatra Viddasya. Raktava Srotas Viddasya. Chavangata Jvara Daha and Panduta is a lakshan of Raktava is a Raktava Sruto with the lakshan. Shonitati Gamanam Nitra Rakta Nitratacha. So how come this Pandu is Pandu is involved? Actually, Amvata is we usually learn it under Rasava Srotas, and then Pandu is also under Pandu is also Rasava Srotas Lakshan. Now, Rasa Pradocha Roga Aruchi Achradda Aruchi Asyavarasya Arasadneta Rullaso Gauravam Tandra Sangamardo Jvarastama पांडुत्वम सुरतता मृदा क्लैब्या सादा कृचांगता नाशोग्ने राजथा कालम वलया पलते. Now you can see that these all these underlying symptoms are there seen in Amvat. Aruchi, these Asyavarasya Arasadneta are probably contemporary. Then Rullas is another Lakshan. Angamartha Jwara is also there. Srutamruda and Nachogni. So all these are Ritsapradocha Lakshan, which are some of which are described in Amvat also. Sushrut has also described similar Lakshan. Anna Shraddha, Arochaka, Avipaka, Angamartha Jwara, Lastupti Gaurav, Ritpanduru. Here he has mentioned Panduru, Margoparo, Srotoro, Karshya, वैरस्य अरसत अंगसात अकालज वलिपलित दर्शन प्रभु. Now, and these are Amalakshana, Srotoroda Balabramcha, Gaurav Anil Murta, Alasya Pakti Nishtiva, Malasanga Aruchiklama, Lingam Malanam Sama. So, I mean, although I don't want to comment anything, you can see that some of the Lakshanas of Am are there in the list of Rasadushti Lakshana. We have 8 types of Pandu. Actually, 4 are by Sushrut Vagbhat, Bhakshananjanya by Tarak, and these are by Kamala and Halimaka are by Harita. These are mentioned in these are mentioned in the Dallana Tika. Actually, Pandu is described as a Lakshana in these 18 conditions. I've taken this from this source. I'm sure there are many more in which the exact word Pandu is not used. Maybe some other word like in Kumi, they have mentioned Bekavarano Hatendriya. So that is not mentioned in here. So number 1 is this thing. Number 1 is Sapradosh Shajalakshan. Then Shwas Sannipatodara Plihodara Shotha Santarpana Nimittaja. It is not mentioned in Apatarpana. It is mentioned in Santarpana Nimittaja. Okay, now those mentioned in those which are highlighted in red are important as far as this lecture is concerned. Rasapradocha Jalakshan, Jirana Jwara, then Rajakshma, Raktarbuddha, and most important is Grani. These Raktasrav, Kafajarsha, Raktarsha, Raktapitta, Upadra, and Katikataruna Marmove are the anemias because of excessive bleeding. So the anemia of actually there are various causes of anemia of chronic diseases. These like infections, I have told in last slide, Jirana Jwara, Punaravarta Jwara, and Rajakshma. Acute and chronic viral infections, HIV, bacterial, TB, parasitic and fungal infection. Then cancers, hematologic and solid tumor. Here they have mentioned Raktarbuddha. Autoimmune, RA, SLE, other CTDs, connective tissue diseases, vasculitis, sarcoid and inflammatory bowel disease. Here they have mentioned granny. Then chronic rejection after solid organ transplantation, and then chronic kidney disease and inflammation. So autoimmune diseases are will especially be covered in this particular uh, lecture. Now, actually, we had studied 28 rheumatoid factor positive female patients of RA were retrospectively analyzed for hemoglobin concentration and red cell morphology. All patients were diagnosed by me as per ACR classification criteria. Age 30 to 65 years. Out of them, 10 were menopausal. 1 had undergone hysterectomy. 5 had irregular menses and 12 had regular menses. Now the days on therapy, 0. The hemoglobin was 9.8. On the day 90, the hemoglobin was 10.28. That is a rise of 4.89%. And on day 180, that is after 6 months, the hemoglobin was 10.65. That is a total rise of 8.67% only. Usually, if we give supplements to these people, supplements of iron, in a case of iron deficiency anemia, the hemoglobin should usually get corrected. Within say 2 to 3 months. Here, even after 6 months, with oral iron, actually oral iron was not supplemented. Here, just with control of the disease activity, the hemoglobin has risen by 8.67%. Although not a very significant achievement, but still there is some significant rise. Now, out of these patients, the initially the anemia was normocytic normochromic in 9 patients, which was in 18 patients on day 360, normocytic hypochromic in 11 and 4, and microcytic hypochromic in 8 and 6. So this is how the cells look like. It's MCV, MCH, MCHC, and RDW. I think everything you already listened to in the earlier lecture. This this thing, normocytic normochromic anemia, is important. This is the one which occurs in the cases of anemia of inflammation, in which the MCV is normal and MCH is also normal. So anemia of inflammation is usually, the hemoglobin is usually more than 8 grams. Anemia is usually normocytic normochromic, which may later become microcytic because of the absorption issues. Then serum iron and transferrin, which binds to iron to make it soluble and delivers to various tissues, are decreased. Serum iron and transferrin are decreased. Then ferritin is increased, which may be normal, but usually increase, and the total ion binding capacity is decreased. So these two are important things. Ferritin is increased and total ion binding capacity is decreased. The reticulocyte counts are normal because the cells are normocytic and normochromic. So the most important indicators in anemia of inflammation are low total ion binding capacity and a normal or elevated ferritin. Okay, now everything, all this um, pathogenesis of anemia uh, is around various cytokines. So we know of cytokines. Anya doshebhyo evati dushtebhyo अन्योन्य मूर्छना कोद्रवेभ्यो विषस्येव वदन्ति आमस्य सम्भव. So the cytokines, they act on all cells. They uh, uh, um, I mean, we have some cytokine producing cell which releases cytokine which goes to the target organ and has some effect on it. So hepcidin is very important in this anemia of inflammation. Hepcidin production in anemia of inflammation is induced by a pro-inflammatory cytokine known as interleukin 6. There are various interleukins. Interleukin 1, 2, 6, 17. These are important in rheumatoid arthritis. I'm not going into details of interleukins because the issue is too complex. But remember that this is interleukin. Interleukin is a cytokine, which IL-6, I'll call it as IL because we are usually habituated to call it IL instead of interleukin. Hepcidin production in anemia of inflammation is induced by pro-inflammatory cytokine IL-6. Hepcidin binds to the ferroprotein on the membrane of iron exporting cells. Export of iron from macrophages and small intestinal enterocytes is inhibited. So that's why iron remains trapped inside these cells in the form of ferritin. So this is how the ferritin increases. You can see here the inflammatory cell IL-6 hepatocyte. You can recollect that liver is a Mulasthan of Raktam Srotas. Hepcidin is released, something like Raktadatvagni maybe. Hepcidin is released, which then bind to the ferroprotein, which will not allow the iron in the macrophage to become available for other cells. So the iron remains inside the cell and it is not available for making new hemoglobin and so on and so forth. There are other cytokines which are known as TNF alpha, tumor necrosis factor alpha, and IFN gamma, interferon gamma. TNF alpha inhibits the erythropoietic production the proliferation within the marrow and survival of RBCs in the peripheral blood depends upon EPO, erythropoietin. EPO, uh, 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 so this particular thing enhances the degradation and phagocytosis of the decaying red cells. Then there is direct inhibition of erythropoiesis and there is stimulation of ferritin synthesis. This is because of tumor necrosis alpha inhibition of EPO. And interferon gamma also inhibits the production of EPO, which increases intracellular iron by inhibition of the ferroportin. So this simple table, everyone has to remember how to differentiate anemia of inflammation versus iron deficiency anemia. You can remember that if ferritin levels are high, more than 50 micrograms, then it is anemia of inflammation. If it is low, then it is anemia of then it is iron deficiency anemia. The other things are given: iron calcium, estimation of iron, total iron binding capacity. These are expensive tests which are not feasible in our routine practice. The most important thing, you can always suspect anemia of inflammation by a normal MCV and a normal reticulocyte count. Very simple. Every report of hemogram will give you the ideally it should give you the reticulocyte count. MCV is always there. If these two are normal, then one should suspect anemia of inflammation. I was talking about rheumatoid arthritis all this time. Now, ankylosing spondylitis is also like an arm war, which mainly involves spine. So anemia and spond arthritis. They have studied the records of 2,522 actual spond arthritis patients who had anemia, just 9% of them. So the percentage of patients having anemia in ankylosing spondylitis, is low as compared to rheumatoid arthritis. But anemia is associated with anemia in these patients is associated with higher disease activity, higher acute phase reactants, that is CRP and ESR, and a more severely impaired physical function, mobility, and quality of life in axial spondyloarthritis. And I mean, as we have seen that in rheumatoid arthritis, anemia means more damage. So here, that anemia is not related to damage. It seemed to not independently predict the radiographic structural damage. Here, I just searched and find out. I mean, I could find out in the Sandhi chapter that Chestavanta Sandhayo. I mean, we have two types of Sandhis, Chestavanta and Chestavanta Tira. Now, Chestavanta is also two types, Alpachesta and Ucheta. Here, in Pratyakshacharya of Bhava Prakash, पृष्ठवंशादिषु अल्पचेष्टा अन्यत्र पुनर् अचेष्टा 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 पुनः संदेय एटसेट्रा तेषु हि प्रयोजनाभावात् श्लेष्मधर कलायाः अभाव. Now there is no Shleshmadhara Kala in um, uh, um, um, I mean in the spinal joints. That is what this particular statement is saying. I mean, it is the maybe you can call it as an armchair thinking, but I have a feeling that Dhatvagni will act only if I mean only if there is some membrane, synovial membrane inside, like this because there is no Sthiti Kala there. The anemia, that is Rasadushti, Amotpatti, I mean, these are not able to make any damage on the axial joints, not axial joints, on the vertebral joints. This requires a lot of discussion. I'm not very sure whether I am right or wrong while discussing this issue. Systemic lupus erythematosus is a 100% arm disease. There are various causes of anemia in systemic lupus, like ACD. Then there can be blood loss, nutritional myelofibrosis, treatment-induced immune-mediated hemolytic anemia. Then there can be microangiopathy, renal failure, infections, and hypersplenism. SLE, 60 to 80% of the patients will have anemia of inflammation. Other common causes, as I already said, iron deficiency, hemolysis, and chronic renal insufficiency. Again, EPO is low. EPO is low due to chronic inflammation and renal insufficiency. And there are anti-EPO autoantibodies are also there. Suppression of erythropoiesis, IL-1, IL-6, IL-10, TNF-alpha, and interferon gamma are the cytotoxins. Then coming to Grahani, I just checked that in this thing, Vataja Grahani, this Vata Rudroga Bulmarcha, clear Pandutva Shankitaha. That means there is suspicion as if the disease is the disease is like Pandu, but it is not so. That is what Vagbhat is saying about Vataja Grahani. Interestingly, among the various compounds used in the treatment, described in the treatment of hernia in the 15th chapter of Chikitsastan, these 8, 1, 2, 3, 4, 5, 6, 8. The first 2 are Churna, Munimmadi, Kiratadi. Then 3 are Asavaristas, and these 3 are Ksha. Everywhere there is a mention of Pandu. Kamala Jora Pandutva Meya Ruchi Atisarandu. then किरातादि चूर्ण हृत्पांडु ग्रहणी रोग गुल्म शूल अरुचि ज्वर पिप्पली मूलचार हृत्पांडु ग्रहणी दोष गुल्म उदावर्त शूलन this one कफ वातार्शो ग्रहणी पांडु रोग रोगवान सर्पिशा पिबेत. So I mean in our Athole's book of Chikitsa, I mean there were various kalpas given in which a single drug acts in both diseases, which means that there is something in common in these diseases. Inflammatory bowel disease, anemia. Anemia is the most common metabolic complication of IBD. It is caused by chronic intestinal bleeding, inflammation and ulcerations, impaired absorption, malabsorption, and toxic effects of medication. Anemia indicates IBD disease activity and extent. Again, the same thing. And it correlates with CRP. Increase again same cytotoxin. TNF alpha, IL-6, IL-1, and IL-17 leads increased hepcidin activity and decrease the expression of erythropoietin. And oral iron, we cannot give oral iron in all these patients because poor absorption due to inflammation, then oxidative stress, then because of damage, then more inflammation and a possible risk of carcinoma. That means replacement of iron is not the therapy. Oral replacement of iron is not the therapy. In inflammatory bowel disease, one has to do Deepan Chikitsa only. So, Ama and Raktaksha, everything is very well known to you. उष्मणः अल्पबलत्वेन धातुमाद्यम अपाचितं दुष्टमामाचयगतं रसमामं प्रचक्षते. I am not going to talk anything on these. अन्ये दोषेभ्यो एवाति दुष्टेभ्यो अन्योन्य मूर्छनात् कुदरेभ्यो विषस्येव वदन्ताम् सम्भव. Then रसात् रक्तं ततो मांसं मांसात् मेदस् ततोऽस्ति च अस्तो मज्जा ततः चुक्रं चुक्रात् गर्भः प्रसः. स्वस्थानस्य कायाग्ने अंशा धातु संस्कृता तेषां सादाति दीप्तिभ्यां धातु क्षयो भव पूर्वो धातु परम कुर्यात् वृद्धक्षीणश्च तद्विधम्. So what are the effects of this Raktaksha and how the other dhatus are also involved in this particular case of Amvata? So I got this one paper published in 2013 in Ayu. They used this thing Panchakol in the dose of 2 grams TID for 6 weeks in tablet form. So this is not iron supplementation, not at all. This is only Agni Deepan Chikitsa. And they observed 30 to 66% improvement in various individual features like Amlashita Prathana, Agnimanda, Daurbalya, Panduta, Twakparicha, and Chira Chaitanya. Hemoglobin rose from 8.14 to 9.46, 46, that is 16.2%, and total iron binding capacity rose by 6.15%. This is for Raktaksha, this is not for Amvata. But the basic aim of this particular study was to evaluate the interrelationship between Jataragni and Dhatu. That means if you treat with Agni Deepan drug medication, the Jataragni, the Dhatu Deepan will also occur, and the I mean, Dhatukcha Lakshana or Dhatu Dushti Lakshana will also improve. Now, this is about Khandurog, the introductory shlokas by Charak. Doshaha dosha pitta pradana yasya kuptanti dhatuchu shaithilyam tasya dhatunam gauravam chopajati. Now about Gaurava, Chakravarti says that Gauravam kriyasu kriyasu गौरवम पांडुरोगिणो निस्सार धातुद्वात् इति ब्रुवते. ततो वर्ण बलस्नेहा ततो वर्ण बलस्नेहा ये चान्ये अपि ओजसो गुणाः व्रजन्ति क्षयम् अत्यर्थं दोष प्रदूषण, which means that if the which means that this particular Raktakshaya will also lead to Ojakshaya, which also means that this Raktakshaya will lead to the Kshaya of further dhatus, that is Maunsameda Asti Majja Chukra. Now, how this Maunsakshaya occurs? There are two different things, rheumatoid sarcopenia, rheumatoid cachexia. So, sarcopenia is reduced muscle mass, and rheumatoid cachexia is loss of muscle mass, but no reduction in the fat tissue. Then this Maunsakshaya is again due to these cytokines TNF alpha and interleukin 1 beta. It occurs in inflammation like high CRP and ESR. Inflammation or amavastha is the main causative factor. These patients also have lower. These patients will also have asthikshaya. That is, we'll come to that. Sarcopenia is in rheumatoid arthritis is not related to severity of the disease, and there are various risk factors like age more than 60 years and presence of feasibility. Age more than 60 means we can understand that it is because of Jaravastha. And presence of the disability means the young, which will not allow any movement of the muscles, and the muscles are certainly going to be weak. Medaksha, there is a typical lipid paradox in RA. Lipid levels are low while CV risk is high. Total cholesterol, LDL cholesterol, and atherogenic ratios are lower. And increased, there is increased cardiovascular risk due to inflammation. Asthikshaya, 30 to 50%. Actually, it is it was a diagnostic classification criteria of osteopenia in the hand X-rays and erosions of the bones. Asthikshaya occurs in 30 to 50% patients of RA. Risk depends upon age, sex, severity, and duration of the disease. Higher incidence of fractures. Then the drugs, some of the drugs also increase the risk. And the cortex is more susceptible. So the fractures usually occur at distal radius and neck femur. And osteoporosis is also due to inflammatory cytokines. These are inflammatory cytokines are different. I'm not going to discuss them here. Then Majjakshaya, Aslam Majjani Sauchiryam, Thamas Brahma Timiradarchanam. Then Chukraksha, Ojaksha, there are various systemic features described. I just read with interest this particular shloka by in Sushruta Samhita and Shosh Adhyay. Vyavaya Shoshi. Shoshi, you know, different types. Vyavaya Shoshi. Shukrasya Kshayalingai Upadruta Pandu Deho Yatha Purvam Kshiyante Chasya Dhatava. So that Vyava, that this thing Vyavaya Shosh will have Pandu as a Lakshan, and all his dhatus, all dhatus of the patient would undergo Kshay. So these are the 5 Lakshanas which we had selected, 42 patients. They were asked to rate these symptoms except the hemoglobin, I mean anemia, on NRS scale. The initial symptoms, how they improved: Daurbalyam Mukhachocha, Pandutvam Sadanam Shrama. So overall improvement after treatment in 360 days, 1 year, was 42% in Shukraksha Lakshana. So Shukraksha is something like fatigue. It can be explained as Daurbalya Sadana Shrama Klama. I know that the technical definitions of different are different for these terms, but most of them indicate what is known as fatigue these days. And so all these 4 lakshanas which are explained in Pandu as well as in Amvata are the constituents of fatigue. These are disabling symptoms in 18 to 100% of the patients. And fatigue is a reliable and reliable, sensitive and unique outcome measure in RA. You can just inquire about fatigue if the patient says that very severe fatigue, that means the RA disease activity is also very high. It indicates active disease. Absence of fatigue indicates remission, and measurement of fatigue provides information on outcome of RA. We have very simple tool with this. So many questions, 13 questions asked, and the patient is asked to rate them. This is known as FACIT, Functional Assessment of Chronic Illness Therapy, FACIT Fatigue Scale. That scale is available on this site. I think it is available on my sites also, translated into Marathi and Hindi. So Ojaksha in RA, actually these are Ojaksha Lakshanas. Out of these, the underlying Lakshanas are the Lakshanas in Amvat also: Shrama, Glani, Tandra Nidra, Murcha, Maunsakshay, Maram Chabalakshay. It is now known that the rheumatoid arthritis shortens the lifespan by 7 years if it remains active, if it remains untreated. So for Rasakshay, we have Mukhashosha and Shrama, Raktakshay, Pandu, Maunsakshay, Daurbalya, Sadana, Chandichul and Sarcopenia. Medakshay, there is lipid paradox, Astikshay, osteopenia, bone pains, Majjakshay, Sandichul, osteopenia and Vataroga, Shukrakshay, fatigue. And management consists of controlling the underlying disease. And the hemoglobin will improve on its own. the Raktakshaya will improve on its own. And high dose intravenous iron is now being advocated to bypass the hepcidin, uh, hepcidin blockade. Now, which means that you are bypassing uh, the Datvagni, the mechanism of Datvagni, while if you use high dose intravenous iron, intravenous blood is not indicated because that uh, that uh, uh, heme and iron will get trapped. Oral iron works only in cases of nutritional overlap. But oral iron, we have already seen that oral iron is not uh, 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 very much advisable in the cases of inflammatory bowel disease or in the case of granny. So it is essential to identify these patients of anemia because anemia affects the quality of life of the patient. And hemogram is an easily available investigation for objective assessment of disease activity also. And it may also be used to monitor efficacy of treatment. If you are treating AMOT, and if you see a patient is anemic, say the hemoglobin was 8.5, and if you treat for say for 1 month, 2 months, and the hemoglobin becomes say 9.5, which means that your treatment is working. If it is not improving, that means that particular treatment is not working. So now, I mean, a lot of other issues were discussed along with Raktakshaya. I must thank you all for your patient hearing. If there are any questions, you can ask now. I might be able to answer them now, or maybe I'll answer them later on. And any suggestions are welcome. The topic is open for discussion. Sandeep?
मनपूर्वक धन्यवाद सर। मैं श्रोताओं से विनती करता हूं कि अगर उनके कुछ सवाल या शंकाएं हैं तो वो सर से पूछ सकते हैं। अपने क्वेश्चन चैट बॉक्स में भी डाल सकते हैं आप।
नमस्ते सर जी। अभी फिलहाल तो कोई चैट बॉक्स में नहीं दिख रहा है सवाल।
हाँ।
मेरे मन में एक सवाल है ये विषय से लेकर।
हाँ, बोलिए।
बहुत बार थोड़ा टेक्निकली हो सकता है, लेकिन बहुत बार इस तरह से संभ्रम निर्मित होती है और फिर न जाने वो मुख्य बात जो है वो कहाँ से कहाँ भटक जाती है। तो इसके लिए मैं ये पूछना चाहता हूँ कि ये जैसे हमारे यहाँ पे आम शब्द एक जाठराग्नि से लेकर खास करके उसको समझा गया है, उसी तरह से धात्वग्नि मांद्य के विषय में भी आम शब्द को हम लोग समझते हैं। तो ऐसे में साम रक्त, जैसे हम लोग सामवात कहते हैं, साम पित्त कहते हैं, उसी तरह से साम रक्त कहे या रक्तक्षय अलग है और आम अलग है, इस तरह से उसको समझे। आपने जो बहुत सारे इस तरह से रुग्ण देखे हैं आमवात के लिए, तो उसमें आपने आमवात इस तरह से एक व्याधि निश्चित रख के उसके बारे में, रक्तक्षय के बारे में उन दोनों का संबंध सोचा है। लेकिन मैं ये पूछना चाहता हूँ कि वो साम रक्त है या रक्तक्षय ही है वो?
एक्चुअली मुझे तो वो रक्त चाहिए लगता है, क्योंकि सामरक्त अगर हो तो एक्चुअली सामर्थ्य की संकल्पना है नहीं। एक्चुअली हमारे जो भी ग्रंथ है उनमें वास्तव में होनी चाहिए, लेकिन वो नहीं है फॉर एवरी धातु। क्योंकि दोषा दूषाच दूषिता, ऐसे जब कहते हैं, जब साम मल के लक्षण देते हैं, साम दोषों के लक्षण देते हैं, तो पता नहीं धातुओं के साम धातुओं के लक्षण जो है क्यों नहीं दिए है। तो आ, लेकिन साम रक्त जो है कुछ तो है, साम रक्त है, साम मांस है, साम रस भी है और साम शुक्र भी है। एक्चुअली एक जो आजकल जो बुक लोग बहुत ज्यादा लोग ये कहते पढ़ते हैं, वो लोग बोलते हैं कि उसमें तो वो साम रक्त, साम रस एक्सेट्रा के जो लक्षण दिए वो जैसे कि सामरस के लक्षण दिए वो रक्त प्रदोष लक्षण ही दिए हुए। आई हैव वन बुक बाय बैडगी, उसमें उन्होंने वैसे ही किया है। दे हैवंट गिवन एज प्रदोष। तो बट आई थिंक that requires a separate seminar about each and every dhatu, as to what would be the samalakshan of, say, samalakshan of mouse dhatu, and what would be the samalakshan of shukra dhatu. It is the important issue which needs to be sorted out separately.
जी धन्यवाद सर। मुख्यतः ये बात मेरे दिमाग में इसलिए आई थी कि जब आपने पांडु इस तरह से एनीमिया के समकक्ष एक शब्द का इस्तेमाल आपने कर रहे थे, तब ये चीज को मैंने ध्यान से देखा कि एनीमिया में भी रेड ब्लड सेल के हिसाब से उनकी कमी का होना, इस तरह से एनीमिया को समझा गया है। और यहाँ पे भी रक्त वर्ण के हिसाब से, रक्त धातु का वर्णहीनता के हिसाब से हम लोग पांडु को, क्योंकि पांडु वर्ण है और रक्त भी वर्ण है, तो इस हिसाब से उन बातों को हम लोग समझते हैं। तो इसलिए ये शंका मेरे मन में आई, ताकि जब वो आमवाद की ओर जाता है व्याधि, तो शुरू में ही ये बात जब जब धातु बनना शुरू हो गई, तभी वो दोष उसके साथ आम जुड़ जाता है, और वो फिर वो सामवाद की तरह से आमवाद बन जाता है। और सामवाद आमवाद इस तरह से सिर्फ शब्दों का आगे पीछे होना, संज्ञाओं का आगे पीछे होने से एक व्याधि स्वरूप को वो प्रकट करता है। तो यहाँ पे भी रक्त के माध्यम से ही ये सारी बातें होती है। और आपने जो इन सारी बातों का जो एक लिंक दिखाया था कि यकृत प्लिहानो इसका जो मूल है रक्त स्रोतस का, और उसके साथ साथ ये हेप्सिडिन के बारे में आपने एक विशेष बात रखी थी, तो जिसकी वजह से ये रक्त वर्णता लाने में जो दिक्कत आती है जो लोग को, तो उसके बारे में जो आपने बात रखी थी, उसका कहीं ये आम की वजह से ये बात बनती नहीं है, ऐसे मेरे कुछ दिमाग में चल रहा था, इसलिए मैंने ये सवाल पूछा आपको।
यस, और एक ऐसा है कि मैं अभी आप जो आपकी जो शंका है, मैं जस्ट सोच रहा हूँ, जस्ट आई मीन अभी तक मेरे मन में कुछ विचार नहीं है, लेकिन मैं बोलता हूँ कि देखो, रक्तक्षय से हम लोग तो अभी के लिए तो आरबीसी रेड ब्लड सेल ही मानते हैं, या अगर उसको रक्तक्षय रेड ब्लड सेल मानेंगे तो फिर माइक्रोसाइटिक हाइपोक्रोमिक एक और दूसरी ओर नॉर्मोसाइटिक नॉर्मोक्रोमिक फिर भी एनीमिया हो, तो उसमें कुछ आई डोंट नो साम निराम हो सकता है क्या? आपको क्या लगता है? अगर सेल का साइज सेम है, अगर अगर सेल का साइज इंक्रीज होता है तो जो मतलब जैसे कि B12 डिफिशियंसी मेगालोब्लास्टिक एनीमिया हो गया, तो सेल का साइज इंक्रीज होता है, तो उसके ऊपर से कुछ सोच सकते हैं कि उसका भी मतलब उसका भी विचार इसमें इसमें होना चाहिए। लेकिन हम लोग अभी सामता और साम लक्षण लेकर ही बैठेंगे तो मतलब उसके हिसाब से आगे नहीं जा सकते, शायद इससे और ज्यादा आगे नहीं जा सकते। और डिस्कशन में आपने आई थिंक लास्ट वीक एक्चुअली ये बहुत मुझे शॉर्ट ये मिला है, पीरियड मिला है, लेकिन अ, हम्म, ये इसमें पित्त का भी रोल हो सकता है। साम पित्त, पित्त से रंजकत्व आता है, तो क्या हम्म, उसका भी कुछ रोल हो सकता है? दैट इज वन मोर इश्यू। वो मैंने कुछ देखा नहीं है इसके बारे में ये लेक्चर बनाते हुए। वैसे भी बहुत सारी दिक्कतें आई, लेकिन ठीक है चलो।
जी धन्यवाद सर।
एक
अब
कोई पूछ रहे हैं कि थायराइड के बारे में, तो उसके बारे में मेरा ज्यादा अभ्यास नहीं है, आई एम सॉरी। लेकिन मैं आपको देख के जरूर बता सकता हूँ। उन्होंने कहा है कि कैन वी रिलेट हाइपोथायराइडिज्म एंड हेयर लॉस एज एनीमिया, फेरिटिन डेफिशिएंसी? एनीमिया नॉट फेरिटिन डेफिशिएंसी, फिर भी ठीक है, वी कैन कंसिडर दिस। आई डोंट नो मच अबाउट हाइपोथायराइडिज्म। एक ने कहा है धातु शैथिल्य के बारे में और चर्चा होनी चाहिए। ये उनका सजेशन है डोंगरी जी, आपको इसके बारे में सोचना पड़ेगा।
जी जी
हम्म, धातु शैथिल्य, if the cell is normocytic norm, how it is Pandu? हाँ, तो I mean that is according to hemoglobin, because the WHO definition uh, is based on hemoglobin concentration only, less than 13 in males and less than 12 in females. So, and then we can uh, uh, because the what we call the ranjakat is because of the uh, um, heme and hemoglobin only. So the I mean the pandutva is certainly because of lack of hemoglobin. So even if the anemia is normocytic normochromic, it is still pandu.
जी सर, इसमें मैं एक बात विशेष तौर से बार बार कहता हूँ, लेकिन आज फिर एक बार उसको मैं कहूंगा कि हम लोग जब प्रिसाइज कोई बात को मन में रख के कोई एक बड़ी बड़ी संज्ञा के साथ उसकी तुलना करते हैं, तब हमारे मन में हमेशा द्वंद्व होता है और वही एक सवाल बन के आगे आता है। जैसे अभी ये सुजाता मैडम ने जैसे पूछा कि वो नॉर्मोसाइटिक और
हाँ
इसका
हाँ
पांडु
हाँ
के
हाँ।
साथ हम लोग कैसे करते हैं। तो पांडु पांडु शब्द एक बहुत ही व्यापक संज्ञा है। वो कोई एक विशिष्ट सूक्ष्मतम विचार करके रखी हुई वो संज्ञा नहीं है। आज के तारीख में बात ऐसी हुई है कि आधुनिक विज्ञान से इतने सूक्ष्म और सूक्ष्मतम कह सकते हैं या सूक्ष्मतर कह सकते हैं, अभी भी और सूक्ष्मतम हो सकता है, इतने मूर्त भाव एस्टेब्लिश हो चुके हैं। आई एम प्रिसाइजली सेइंग मूर्त भाव। अब ये मूर्त भावों को आयुर्वेद के अपने पारिभाषिक संज्ञा से उसको कैसे निश्चित किया जाए, ये पहले नक्की करना पड़ेगा, और उसके लिए उनके कार्य, उनके स्वरूप, उनके गुण, इन सबको एक साथ मिलके बैठ के अगर हम लोग कुछ निश्चित करते हैं तब भी जाके ये बात बनेगी। वरना आपके यहाँ पे मतलब आयुर्वेद के यहाँ पे जो एक पांडु शब्द से जो उनको अभिप्रेत जो था, उसको जैसे आपने अपने स्लाइड्स में भी दिखा दिया कि 8 प्रकार के पांडु के बारे में लिखा है या इस तरह से, तो ऐसी बातों को हम लोग जब तक डिटेल में सामने से बात नहीं करते हैं तब तक इस तरह की कंपैरिजन हो नहीं पाती है। और फिर जाके ऐसा हो जाता है कि ये इसमें नहीं है और वो इसमें नहीं है, तो ये मतलब एक अपने ही लिए एक अलग से एक द्वंद्व हम लोग खड़े करते हैं। इसके बजाय कि जरूरी है कि हम लोग ने उसको अधिक से अधिक सूक्ष्मतम अभ्यास करना जरूरी है पांडु के बारे में। जैसे एनीमिया के बारे में, जैसे एनीमिया भी एक बहुत ही बड़ी व्यापक संज्ञा है। हर कोई एनीमिया एक आयरन डेफिशिएंसी से नहीं बन रहा है, ये वहां पे भी है। तो इसी तरह से कॉमन से जब हम लोग स्थूल संज्ञा का इस्तेमाल करते हैं, कॉमन संज्ञा का इस्तेमाल करते हैं, तब उसकी तुलना कॉमन संज्ञा से होनी चाहिए। कोई डिटेल, कोई सूक्ष्म, कोई प्रिसाइज संज्ञा से अगर हम लोग किसी की तुलना करना चाहते हैं तो वैसे वो प्रिसाइज होनी चाहिए, ऐसा मेरा मत है। इसमें ये बात नहीं है कि हम लोग कभी आमतौर पे जिसको जनरलाइज डिस्कशन कहते हैं वहां पे हम लोग इस तरह से नहीं कहे करके गए गए एक लेक्चर में भी रणजीत जी ने, डॉक्टर रणजीत जी ने यही बात कही थी कि वी हैव टू बी प्रिसाइज ऑन एटलीस्ट व्हेन वी कॉल अवरसेल्फ एज वैद्यस। तो इसी ये बात तो हमेशा रहती है, इसीलिए ये सारी बातें वहीं पे जाके अटक जाती है, क्योंकि हमारे पास उनको प्रतिशब्द नहीं है, और प्रतिशब्द नहीं है इसलिए हम लोग अपनी बात को व्यक्त नहीं कर सकते। लेकिन ऐसा नहीं है, हमें चाहिए कि उनके गुण कर्मों को देखें, और गुण कर्म ही हमेशा आगे आते हैं। तो आप नाम चाहे उसको हीमोग्लोबिन दीजिए, या यहाँ पे उसको हीम यानी लोह, और ग्लोबिन यानी प्रोटीन, इस तरह से उसको ये कर सकते हैं। तो भाषा से कोई बहुत बड़ा अंतर नहीं होता है, बात बनती है कर्म और गुण से बनती है, द्रव्य तो बगैर उसके है ही नहीं। तो द्रव्य की बात हम लोग जब भी करना चाहते हैं तब हमारे मन में यही अभिप्रेत होना चाहिए कि हम उसके गुण और कर्म की बात कर रहे हैं। हमें तो कर्म से मतलब है, हमें तो उन कर्म क्यों हो रहा है तो उसके गुण से हो रहा है, और ये सब वो द्रव्य में रह रहे, इसलिए द्रव्य हमारे लिए इम्पोर्टेंट है। वरना हमारे ऐसे द्रव्य तो लाखों करोड़ों पड़े हैं, हमें उससे कोई लेना देना नहीं होता है। जो मूर्त द्रव्य की हम लोग बात करते हैं तब हम उसके सूक्ष्म से लेके सूक्ष्मतम चीजों को गुण कर्म के हिसाब से जब तक नहीं देखेंगे तब तक हमारे मन में जो हर हमेशा जो द्वंद्व बनाए रहता है वो बंद नहीं होता है। ऐसे मेरा अपना मत है, कोई जबरदस्ती नहीं है, लेकिन मैं अपना मत रख दिया हूँ। धन्यवाद।
हेलो
जी, और कोई सवाल है?
अजून तरी नाही दिसत आहेत सर कोणाचे.
We can stop,
ठीक है
I
तो
think.
हाँ, चॅट बॉक्स मध्ये तर नाही दिसत आहे।
हो.
सो लगभग आज का ये व्याख्यान और सेशन जो है जूम मीटिंग का वो समाप्ति की ओर जा रहा है। तो पहले तो मैं लाख लाख धन्यवाद देता हूँ डॉक्टर और वैद्य दोनों एक साथ होने की वजह से, डॉक्टर श्रीकांत जी को। और ऐसी बात है कि उनकी मेरी पहचान तो थी नहीं पहले। ये हमारे जो एक क्या कह सकते हैं कि एक स्तंभ है विष्णु जी जोगड़ेकर, उनकी वजह से मेरी और श्रीकांत जी की पहचान हुई। और बाद में पता चला कि हम दोनों भी एक ही वर्ली के पोदार इंस्टीट्यूट से है, तो और उससे गहरा संबंध आया। सर तो हमसे काफी सीनियर है और सारी चीजों में आगे है हमसे, लेकिन आज एक बहुत ही कम से कम समय में अचानक से उन्होंने मेरी विनती को हाँ कर दी। उसके लिए तो मैं उनका कायम के लिए ऋणी रहूंगा, क्योंकि इतने शॉर्ट शॉर्ट पीरियड में उन्होंने अपना सारा जो स्लाइड्स बनाना और सारी बातों को रखना इतना काम किया है, उसके लिए मैं उनको धन्यवाद देता हूँ। साथ ही सभी सभी श्रोताओं को धन्यवाद देता हूँ, विलोक जी को जो हमेशा हमारे एक स्तंभ रहे हैं इस उपक्रम को चलाने में, और संदीप जी है, और नीलेश पाटिल है, तरन्नुम मैडम है, और भी मेरे सहयोगी है। उन सारों को धन्यवाद देके आज का व्याख्यान यहीं पे समाप्त होता हूँ, ऐसे घोषणा करता हूँ। धन्यवाद।